going to do my community health teaching project for my bachelor's degree in nursing on how venture, your facility here, can meet the needs of your community, and that would be health needs as well as crisis assistance needs. The largest crisis needs for the residents in this community would be food, clothing, shelter, financial, and utility assistance. There's lots of federal and state programs. The ones that we're most common with, of course, are food stamps, the Second Harvest Food Banks, the Metrolina Food Banks, and the WIC program, Women, Infants, and Children's, which is managed by the Health Department here in Gaston County. Local food assistance programs are what a lot of crisis ministries are involved in, what churches are involved in. So you've got the Crisis Ministry of Gaston County, Dallas Christian Ministries, the Gaston Baptist Social Ministry, Salvation Army, and then of course your Venture Church Food Pantry here. These are places that if people are in need of food, after their monies have run out for the end of the month, then they would be able to get food at these locations. Clothing assistance can be obtained through the Crisis Pregnancy Center, where you can receive baby clothing, maternity clothing, diapers, furniture, formula, and bottles. Then you've got the Dallas High Shoals Christian Ministry, which is the Dallas High Shoals area only. There's Gaston Baptist Social Ministries, Salvation Army, and of course your Venture Church Clothing Closet. Emergency shelter is another area that I've run into in this community that people occasionally might need and are typically at a loss to find solutions to their situation. I was not aware of all the different shelter facilities that are available for your area, and so I've put those together here. Adams House of Gaston County is a residential program for young men ages 18 through 21. They do have to meet certain criteria to be able to live in this facility, and they have to maintain those criteria throughout the time that they're a resident there. Catherine's House is a shelter for single women and women with children. The Interfaith Hospitality Network is a shelter for families, as well as the Red Cross. Salvation Army is a shelter for men, women, and families. The Shelter of Gaston County is a domestic violence shelter for women. And then With Friends is a shelter for homeless teens in Gaston County. Financial and utility assistance is another need in this area that oftentimes comes up when people are not able to pay their power bill, their water bill, their gas bill, those types of things, and they need assistance. The Department of Social Services offers emergency assistance and in addition to food stamps and Medicaid. The Salvation Army offers assistance. St. Michael's Catholic Church, the Gaston Baptist Association, Crisis Assistance Ministries, and then the Dallas High Shoals Christian Social Ministry also offers assistance with financial needs and utility assistance. The second part of this presentation is based on the Community Health Assessment Report for Gaston County, and then also the Quality of Life Survey that was done in 2012. The Community Health Assessment Report was prepared by the Gaston County Health Department, Caramont Health, Gaston Together, and the United Way of Gaston County. So these are in two parts. The Community Health Assessment is based on the medical providers' opinions. That would be hospital, health department, doctors, nurses, those types of things. And then there's a Quality of Life Survey that was sent out to leaders and residents of the community. So the demographics in Gaston County are the population is predominantly female at 51.6%. The largest population in this area are the 20 to 44 year olds. The town of Dallas has 4,488 people as of the 2010 census, and then 16.9% of Gaston County residents are below poverty level. The highest populations who are below poverty level are single mother families at 47%. So what that means is out of this 16.9% of Gaston County residents that are below poverty, nearly half of those are single mother families. So in gathering the data for this survey, a total of 3,015 persons completed the survey. 1,399 were high school juniors, 1,104 were community residents, 319 were community leaders, 193 persons were from low-income neighborhoods. So the leading causes of death in Gaston County from 2007 to 2011 by race are broken down here, and these are rates per 100,000. So in the white non-Hispanic category, the number one cause of death was heart disease, as with African Americans. Cancer was number 2 in both. Other ischemic heart disease was number 3, and that would be things like heart attack, stroke, blockages, things like that. Then at number 4, you start to see a little bit of a difference: chronic lower respiratory disease for the Caucasians, and then prostate cancer for African Americans. That is most likely, the difference is most likely attributed to the fact that African Americans are not, do not have the availability for the pre-checks typically that white people do. Then lastly is tracheal, bronchial, and lung cancer, which are most likely related to tobacco use and smoking. So there's 3 major healthcare priorities that come out of that list that we just saw. According to the healthcare statistics and reports, these are the top 3 healthcare priorities for Gaston County: reducing obesity and increasing physical activity and good nutrition, reducing tobacco use and substance abuse, and reducing teen pregnancy. In 2011, there were 290 total teenage pregnancies between 15 and 19 years old in Gaston County. Between 2007 and 11, there were 1,827 births to women ages 15 to 19 years old. Most of those occurred in the Hunter, Huss, and Ashbrook and Bessemer City high school districts. So this is the quality of life survey that was done of the community members, not the healthcare leaders, but the community members. In 2012, the top 10 leading community health problems for all survey respondents were obesity, illegal drug use, teen pregnancy, alcohol abuse, lack of prescription drug use, and that would be inability to obtain their prescriptions, high blood pressure, diabetes, heart disease, mental health, and cancer. The top 5 ranked community health problems by the survey, again these are the community members' opinions, are ranked here. It's divided by all respondents and then community low-income leaders and high school juniors. All respondents said that obesity, illegal drug use, and teen pregnancy were the top 3 health problems in the survey. And again, this lines up with the top 3 priorities in healthcare by the healthcare leaders of the community. It was interesting to me how the high school juniors differentiated in those, in their top 3. Their top 3 were teen pregnancy, obesity, and illegal drug use. So it was basically almost a reverse order for them. Social issues in the survey that were specific to youth were broken down again by community members, community leaders, and high school students. The social issues specific to youth that the high school students rated in order were: create job opportunities for teens, increase high school graduation rates, stop physical, sexual, and emotional abuse of youth by family members, help students plan their careers, and then provide job training. One thing that I read in the study were that the high school students' concerns were based on the 2008 financial recession that the country went through, and that students are seeing the importance of high school education and job training and job planning and college planning as a result of the recession. They're seeing their parents unemployed, for the first time possibly ever. Something that I thought was really interesting in the survey, and this was a survey that was published by Gaston County, so this is a governmental survey. On page 63 of the survey, it had health-related support services, and so that listed all the support services that were available to the members of the community, such as hospitals, doctor's offices, dentists, rehab services, social services, Department of Health, those types of things. And so listed under health-related support services was places of worship. It stated that there are more than 300 houses of worship in Gaston County, including churches from a wide range of denominations, a mosque, and a synagogue. With this large number of churches it's surprising that less than half, 45.1% of survey respondents felt they had access to spiritual care for health problems. This could be a reflection of houses of worship not adequately addressing the health needs of their congregants, or an opportunity for healthcare providers to address community health issues. So what this is telling us is that even governmental leaders are expecting churches to be participating in some type of health care for their communities, whether it be spiritual health care or actual health care administration. So how can Venture help meet the needs of the community? And so we're going to address the top 3 health priorities that were set by the county. So reducing obesity, increasing physical activity, good nutrition, reducing tobacco use, and teen pregnancy are the goals that we're trying to reach. Education is a key in reducing illness and promoting health. Community gardening could serve as a source for low-income groups to obtain fruits and vegetables, which are more costly at the grocery store, which aid in promoting heart health and also provides physical activity. Healthy food choice education classes, healthy cooking and eating out classes, and then health clinics promoting blood pressure monitoring, cholesterol checks. Cholesterol rates are rising in Gaston County. BMI checks, diabetes education, and blood sugar monitoring. Something that's going to be key if you're going to do these types of health clinics is going to be follow-up. You're not going to see a constant result, or you're not going to see an improvement in someone's health if you try to get them on a plan but you're not doing any follow-up. So a good thing that you all could implement would be to do follow-ups with the people that you're trying to improve their health. Go to their home, check their blood pressure there, call them on the phone, see how they're doing with their diet, see if they've lost any weight, those types of things, because follow-up is going to be key. Other things that can be done to help meet these top health priorities are exercise incentive programs. You can have voluntary competitions. You can offer free exercise classes. Education on working out without equipment, using your own body weight would be a no-cost option that you could offer to the community. Educate them on how to do those in their own home. Tobacco education, classes and support groups so people can help stop smoking, stop using tobacco products. Youth guidance programs. Those could be mentoring programs, leadership programs. Also after-school homework assistance, organized activities, somewhere to hang out, and safe internet access. That was another point in the survey that was found, was that students were looking for a place, a safe place to hang out and spend time after school, so they didn't get in trouble. Purity education programs to try to work against the teen pregnancy rate. So purity education programs for students and parents, a purity challenge, and then biblical studies on purity. You can also offer CPR classes as well. Some of the things that Venture could do to meet the social needs of the community would be resume building workshops, job interview workshops. You could do mock interviews, how to dress professionally. You can also give classes on pathway to a college education. What kind of grades do you need to get into college? What are college requirements nowadays? The financial aid process, how to find scholarships and loans, and then talk to them about their loan repayment process at the end of college. You can offer money management classes, how to get out of debt, how to set a budget. Even on a fixed income, you can have a budget. Financial goals, buying versus renting the place that they live in. Parenting classes, and these could be held for all age groups from prenatal to newborn, toddler, adolescents, and teens. You can offer classes in all of those age groups. Personal safety classes, like self-defense, marriage education classes are another important thing that could be offered in your community, especially due to the rise in divorce rates. And then language classes can also be offered, such as English or Spanish as a second language. Spanish, or the Hispanic population is fast growing in our area and is almost outnumbering the other minority groups in our area. So the ability to communicate with this group of people is going to be key in the future if we're going to be able to reach them in our communities. These are my list of references, and they're also on the back of the pamphlet that I've made, the teaching tool that I've given to you all. So if anyone wants information on any of this that I've presented, or any information that's on the pamphlet that I'm handing out, it's all listed right here. And you're welcome to use this pamphlet to hand out to the people that you see here in your crisis ministry and to other church members, for educational purposes, in order to give out the information that was provided. Thanks for letting me be here today, and I appreciate it.